Hi, this is Dr. Kwun calling from the surgery. Is this Emma Thompson?
It is, hi.
Hi, can I confirm your date of birth to make sure I've got the right record, please?
Yeah, 24th of June, 95.
Thank you. I could see on the record that you'd like to speak with somebody about something personal. Let me tell you that everything we'll discuss today will be confidential unless I'm duty bound to disclose any information. Okay?
Okay, thank you.
How can I help, Emma?
Um, I need the morning after pill, please.
Okay. Could you tell me more about what's the reason that you need it?
Um, Last night I made a mistake and I'm just really worried that I'm gonna get pregnant.
I see. Okay, so have you used a morning after pill before?
No, I've never needed to.
Okay, to help me understand, so that I can better help you, tell me more about the situation, as in what happened.
Um, so I was staying late at work. There's been a big project on, and it was just me and my boss, Chris. Um, and it was just a complete lapse of judgment. It shouldn't have happened. Um, but now I'm really worried because I just don't want my husband to find out, and I never want it to happen again. And I just really can't bear the thought of getting pregnant over it.
I understand. It sounds like it's been quite difficult for you. So I'm here to help, and we can definitely talk about morning after pill. So I need to ask you a few sensitive questions, all right?
Okay.
Was it a consensual intercourse that you've had?
It was, yeah.
And can I check what type of intercourse did you have?
It was just vaginal.
Okay. Was there any alcohol or recreational drugs involved?
No,
Okay. And can I check when was the last menstrual period you had?
it was like a week ago.
Mm. And have you had any other unprotected sexual intercourse since then?
No,
Have you noticed any bleeding after intercourse?
no,
Any bleeding in between your period at all?
no,
Okay. Any pain during intercourse?
no,
And any discharge at all?
no.
Okay. Sensitive question again. Have you had any sexually transmitted infection in the past?
No, but it's something that I'm obviously worried about now.
Um, we can talk about how you get tested for sexually transmitted infection. Okay. The other thing is, have you had your cervical screening?
I had one about 3 months ago, so I think I'm up to date.
Okay, right. So, thank you for telling me about what's been going on. May I check, have you been pregnant before?
No.
And have you had any women's health issues?
Uh, no, I don't think so.
Okay. So, in terms of work, then, you've been working in that organization for a while, then?
Yeah, yeah.
What's the environment like at work?
It's usually absolutely fine. I get on well with my colleagues and I enjoy what I do. I'm a secretary, but last night was just a complete one-off, a massive mistake, and
Okay,
I regret
I see. And how are things at home?
it. Yeah, they're normally good. Uh, my husband's a pilot, so he's away a lot, which is why I really don't want him to find out.
I can understand that. Yeah. Has there been any changes lately?
No, no.
I could see on the record that you were prescribed microgynon previously. Have you been taking any contraception lately?
No, I stopped about 6 months ago because I was finding that I was gaining a bit of weight from it.
Okay. And how much weight did you gain?
It was a couple of pounds, I think.
Okay, right. And do you have any thoughts about whether you wanted any long-term contraception in the future?
It's something that I'm happy to consider. Um, I don't think that's a decision I can really make today, to be honest. I just don't feel I'm in the headspace for it.
Absolutely. So we can focus on the emergency contraception. So the morning after pill is definitely one of the contraception available, especially after an unprotected sexual intercourse. But there's other options as well that's helpful for emergency contraception. And I don't know whether you've heard, but the copper coil is also one of them that is available. Is this something you'd like to consider?
Um, that doesn't really appeal to me, to be honest, especially because I am wanting to be discreet and hope that my husband doesn't find out. And so the tablet seems to be more suited to that.
Absolutely, I can see where you're coming from. The only reason I mentioned the copper coil is because it's most effective one, but there is also LO1 pill that is very effective and you can take it. Are you feeling unsure about the SCA? Maybe you don't know what to do or you don't know whether you're doing the right thing. If you'd like to get a free copy of the SCA blueprint, click the link down in the description below to get access to the SCA blueprint that GB trainees have already used and passed the SCA exam. It's completely free. Just click the link down in the description below to get access to it. Within 5 days of having unprotected sexual intercourse. So we can talk about that, which seems to be more suitable for what you're looking for. So you could take it today, and I can tell you how it works if you'd like.
Yeah, please.
So what it does is it's going to delay you from having an ovulation so that you don't fall pregnant. Now, it's not 100% effective, but it's very effective. And it can cause some side effects. So you might find that your period might be earlier by a few days or later. It can also cause some nausea and vomiting as well. So if you do have any vomit up to 3 hours having taken the tablet, it's important that you get in touch again with us because you might need to have another tablet. Is that okay?
Yeah, that's fine.
Right. So there is also a small chance that you might develop what we call an ectopic pregnancy, which means a pregnancy outside of the womb. So if you do develop any pelvic pain or any bleeding that's not normal for you, please get in touch with us. Okay.
Okay.
I would recommend to do a pregnancy test in 3 weeks' time, such that we make sure that you're not pregnant. Because although the emergency contraception is very effective, it is not 100% effective. So there is still a risk that you could still fall pregnant. All right.
Okay. Yeah, that's fine.
With this tablet, it is something that we would prescribe and you take it as a one-off. However, if you do have any intercourse in the future, it's important to consider using contraception, for example, condom for the time being or abstain, because it's not going to protect you for other intercourse. It's only for the one that you've had in yesterday. Okay.
Yeah, that's fine.
Okay. Now, you mentioned about sexually transmitted infection. Now, there is a risk, especially if you're having intercourse with somebody who you might not know much about. Now, the sexually transmitted infection are things that can be tested via the sexual health clinic. I could signpost you to the service because they can do it confidentially. And if there is any infection, they will be able to provide you the right treatment. Okay.
Yeah, that sounds great. Thank you.
So I will send you a link for the sexual health clinic details so that you can access and you can give them a ring today to see what they would ask you. It's usually tests, swabbing, and urine sample tests to check for various sexually transmitted infection. All right.
Thank you.
Have you got any questions on what we've discussed so far?
Um, I don't think so. I mean, can I take the tablet today as soon as I get it?
Yes, so definitely we recommend that you take it as soon as you can, so that make sure that you have it straight away. Yeah.
Okay, brilliant. Thank you.
Okay. So I will have a script that will be issued to the chemist so that you can collect it. All right. If you do have any problems with it, then give us a ring back. For example, if you're vomiting or any issues with it. Okay.
Thank you.
Thank you. Bye bye.